Health Secretary Ted Herbosa pushed back against removal rumors as he detailed government priorities in healthcare funding and services. Here's a report.
In an interview with The Big Story, Health Secretary Ted Herbosa dismissed reports that he is set to be removed from his post. He said cabinet officials serve as the pleasure of the president and stressed that he continues to carry out President Bongbong Marcos' mandate.
The cabinet secretaries all serve at the pleasure of the president. The president can replace us anytime. But we continue to fulfill the mandate of this president. The priority is education, health, and agriculture. And I'm up there trying to make sure that healthcare of the Filipino people gets better.
Herbosa also denied facing serious legal challenges, describing the cases filed against him as a mere nuisance complaints.
These are just allegation cases, but we've never received any single notice from the ombudsman since they started filing. So it sounds to me like there are nuisance cases.
Meanwhile, the health secretary said the government's push to expand zero-balance billing will eventually reduce the demand for the medical assistance for indigent and financially incapacitated patients, or MAIFIF. He clarified, however, that this would depend on the PhilHealth's capacity to enhance its benefit packages and cover more medical services.
That depends on how PhilHealth will be able to increase the benefit packages this coming year. This year, we target to implement the diagnosis-related group reimbursement system. Right now, it's a case rate. So if you have pneumonia, there's only one fee for pneumonia. So what we will do with the diagnosis-related is, if you have pneumonia, diabetes, heart disease, all combined together, the reimbursement will be higher. I'm sure the hospitals will be happier to be repaid on this type of mechanism. With this system, I am thinking that the need for MAIFIF program will decline.
Herbosa further assured that the public that politicians are prohibited from intervening in the release of processing of medical assistance funded under MAIFIF in the 2026 national budget. He said requests for MAIFIF aid must be cursed strictly through hospital-based medical social workers.
Basically, what patients should do now is to go to the social worker in the hospital, to go to the hospital director or to the regional director of our Department of Health offices to access medical assistance for indigent funds. And what is also good in the new budget is that the legislators allocated 1 billion pesos so we could expand the ZBB program to local government unit-run hospitals.
On health infrastructures, Herbosa noted the government has funded around 800 super health centers since 2022, with about 500 already completed and 300 still under construction. However, only around 200 of the completed facilities are currently operational, while more than 300 remain non-functional due to a shortage of medical personnel.